Good morning, everyone. My name is Jessica Lopez, Communications Coordinator with United Ag. Thank you so much for joining our health chats this morning. With it being the new year, resolutions are still trying to be kept, and in a world inundated with quick fixes, it's good to get important information on weight loss drugs and how it affects our body. So, without further ado, here's Dr. Rosemary Ku to enlighten us about weight loss drugs.
Thanks so much, Jessica. I just want to take a moment here to thank our sponsors for Health Chats, including Cyene, Blue Shield of California, and Elite Medical. And I'm excited today to talk to you about these GLP-1 weight loss drugs. We'll talk about how they work, the clinical indications, their potential side effects, factors to consider before taking them, and our resources that can help you. And we'll also leave plenty of time for Q&A at the end, and you're more than welcome to chat in questions along the way as well, and we'll get to them at the end. So first off, you've probably seen in the news a lot of press about these trending weight loss medications. The newest ones are all in the GLP-1, so you might hear that term GLP-1 class of drugs. There are lots of different drugs that have been FDA approved along the way for weight loss, but they largely haven't been effective until these GLP-1 drugs. So that's why they're kind of taking the healthcare industry by storm, is that they are incredibly effective. And also they've been really trending on social media because a lot of celebrities have been taking them and they've seen really dramatic weight loss. And they're also very expensive. So that's why they're also, impacting the healthcare industry significantly because of the high cost as well. There are three main GLP-1 drugs that have been approved for weight loss. The first one I have up here is called Zepbound. That was the one that was most recently approved for weight loss. The name that it's actually, these drugs actually were developed as diabetes drugs, actually. So they were on the market well before they were FDA approved for weight loss specifically. And so the second name here, Manjaro, was actually the same compound, but approved for diabetes before. The other one that's also very popular right now, the weight loss version of the drug is called Wegovy, and then the diabetes approved version of the drug is called Ozempic. By the way, when I say version, for Wegovy and Ozempic, the dosing might just be slightly different between the weight loss version and the diabetes version, but these are the exact same compound itself. And sometimes in the press and the news, you might hear them kind of used interchangeably, whether Wegovy, Ozempic, Zepbound, Mounjaro. These are the same drugs. It's just that they were first approved for diabetes, and so they're often referred to as like Ozempic or Mounjaro. One of the older ones in this class of GLP-1s that was approved before was Saxenda. That was also marketed as Victoza for diabetes. The reason why Saxenda is less kind of popular right now is because these are all injections, by the way, but Saxenda actually it's a daily injection, which is pretty hard for people to comply with, whereas Zepbound and Wegovy are weekly injections. So not only do Zepbound and Wegovy have better weight loss effectiveness than Saxenda, they're also a little bit easier for people to take. And between Wegovy and Zepbound, it looks like early data seems like for most people, Zepbound actually has the higher effectiveness. These are relatively new drugs on the market, so we'll really have to wait and see to see which one is truly more effective, and in what types of people. Maybe like a certain drug might actually be better for certain types of people than others. So over time, we'll actually figure out kind of the relative effectiveness of these. But right now, Zepbound does look like it's possibly the most effective out of the bunch with up to 20+% weight loss, which is pretty incredible, with the average being around 15% weight loss. As I mentioned, these are subcutaneous injections. And here's a point that's been highly controversial along the GLP-1 journey is that initially it was thought that these drugs could be used as a short-term treatment for obesity. And then more recently, with longer term studies, it looks like the rebound effect of the weight regain when you stop these drugs is very significant. And after about a year, people generally gain back 2/3 of the weight they've lost. So at this point in time, the sentiment is that these are likely long-term drugs that once you're on, you should stay on for the rest of your life. This is, again, highly controversial for these drugs. So over time, we might get more information about, are there situations in which you can use these short term? What are those situations and who would benefit the most? And who actually would need them long term. So that's an area that we'll kind of have to better understand over time. But at this moment, it does seem like these need to be long term drugs. So how do they work? These drugs basically naturally, they mimic naturally occurring intestinal hormones. So GLP-1 and GIP over here are hormones that are secreted from your intestines and related to the food that you eat. So in the digestive process, these hormones are secreted and they act on different tissues in the body, including the pancreas, stomach, and the brain. As you can see here in the image, on the left-hand side. That first one is a pancreas. It might not totally be clear because of the cartoon. But Wegovy and Saxenda are primarily GLP-1 agonists. So that means that they work on the GLP-1 receptors. And then Zepbound, the one that I mentioned that seems to be more effective than the others, has not only GLP-1 activity, but also GIP activity, which stands for glucose-dependent insulin-tropic polypeptide. You don't need to know the whole name. Just remember that these basically are kind of copying how these intestinal hormones normally work. And so their effect on the pancreas is that they increase insulin and decrease a hormone called glucagon, which ultimately the effect of these changes reduces your blood glucose. That's why they were first developed for diabetes, is because they are very effective at reducing blood sugars. The second major effect that they have on the body is that they slow the digestion of your food. So your food basically stays in your stomach longer. It takes more time for it to go through your digestive system, which means that you're likely to feel more full for longer periods of time, decreasing appetite. And they also work on the brain to decrease both food and water intake. So there are many different ways in which these drugs work on the body to essentially keep you feeling full and make you less hungry, which will obviously decrease your food intake. However, all of these drugs are meant to actually be used with a healthy lifestyle change. I know in the realm of weight loss, there's just so much interest in a silver bullet. There's so many crash diets, fad diets. There's been so many harmful drugs actually over the course of history that have been developed for weight loss that are no longer FDA approved. And so the kind of desire for a silver bullet is very strong, but this isn't meant to be that. This isn't meant to be a silver bullet for obesity. These are actually meant to be taken alongside a healthy lifestyle change, including diet and healthy eating. So the clinical indications for these drugs are pretty set in at this point in time for the obesity requirement. Changes might occur over time. There might be kind of developments where maybe lower BMIs will be approved for these drugs, but this is the current BMI requirements is that you have to either have a BMI over 30, which is the obese category, or you can be in the overweight category with BMI greater than 27 with at least one weight-related condition. And that weight-related condition could be something like type 2 diabetes, hypertension, abnormal cholesterol, sleep apnea, or heart disease. Now, these clinical indications are just for the weight loss side of the drugs. So, like if you have diabetes and you're already on Ozempic, this isn't really applying to you. And by the way, everything that I'm saying during this presentation should not counteract what your doctor says. So, if your doctor says you need these drugs, especially if you have one of these weight-related conditions, please listen to your doctor's own advice. So, I'm just kind of giving more generalized recommendations here. But these are the current clinical indications for these drugs. And then the list of contraindications and warnings is moderately long, but it's something that you have to be aware of. Is that for people with a history of thyroid cancer or certain types of endocrine or hormonal cancers, these drugs are not indicated for you. You're not eligible to take these if you have any that kind of history. In addition, there are pretty stringent warnings on these drugs for potentially causing kidney failure. Remember that these drugs actually cause your water intake to decrease, so that could actually increase your chance of dehydration, and that's how that can lead to kidney failure. They can also cause gallbladder problems, inflammation of your pancreas, low blood sugar, especially if you're also on medications that decrease your blood sugar. In people with diabetes, it can also cause vision changes. And there is also a warning for depression or suicidal thoughts on these drugs. The latest data shows that perhaps Wegovy and Ozempic doesn't lead to depression or suicidal thoughts, but this is still on the warning label. And it's certainly an area where the mental health of people on these drugs is being monitored pretty closely. Also, an area that we don't understand very well right now is the impact on pregnancy and breastfeeding. So, if you're pregnant or trying to become pregnant in the next few months, talk to your doctor. In most cases, you won't be recommended to take these drugs, or you'll be recommended to stop these drugs a few months in advance of trying to become pregnant. But that's actually something really important to keep in mind for anyone, any women in childbearing age. So here are some of the more common side effects. With any type of subcutaneous injection, there could be injection site reactions, which could be inflammation, itching of the site, potential infections of the site. Um, but perhaps the most common ones that I've seen is gastrointestinal side effects. A lot of people might experience bloating, especially because these drugs slow down your digestion. They could also cause nausea, vomiting, diarrhea, constipation, and also heartburn. And so, if you have any of these digestive issues to begin with, such as if you do have acid reflux to begin with, you might want to talk to your doctor about what you can do if you need to be on these medications. In addition, the other side effects include fatigue and hair loss. The hair loss one is still kind of being studied. We aren't sure exactly why that can be a side effect of these drugs. They can also increase your heart rate and cause allergic reactions, in addition to a runny nose or sore throat. Given that these drugs are fairly new, this list will probably expand over time. So here are the main factors to consider before taking these drugs, or to discuss with your doctor if you are kind of in those discussions to take them. The first is long-term medication adherence. Really ask yourself, are you willing to give yourself an injection for the rest of your life every week at least? And that's a big one that, people might in the beginning, they're like, yeah, I can do that. That's easy. I really want to lose this weight. But is it something that you're going to be really willing to stick to? And also, given the fact that these drugs are very expensive, is there a chance that you might change your job or your employer or insurance? And that could actually potentially change how much coverage you have for these drugs. In addition, as I mentioned about kind of the gray area with pregnancy, is that if you do plan to become pregnant, you might have to stop these drugs. And with the potential weight regain, is that something that could impact your health? In addition, some surgeons are also saying that these should be stopped before surgery. Now, most likely you'd be able to get back on them shortly after the surgery or recovery process, but that's something to discuss with your doctor. And also, another thing that's happening commonly is because of how popular these drugs are, there are actually shortages going on. And so, if you are taking these drugs just for weight loss, you might not actually be able to access them because of drug shortages. And so, really think about the long term medication adherence. I know a lot of people are reading about these drugs and they're thinking, maybe I can just take this for 6 months, get off that weight, and then I'll be happy and I don't need to take them anymore. That's not really how the medical community is looking at these drugs at this time. The second point here to consider and to talk to your doctor about is what kind of support are you going to have for maintaining and building these healthy lifestyle changes? So, how are you going to continue to eat better? How are you going to continue to exercise? As people lose weight, sometimes they also lose muscle mass, which will decrease your metabolism over time. So, how can you actually maintain that muscle mass or build muscle mass through this weight loss period? And so you don't have to do this alone. It's really important to develop your support system to make sure you can actually make those healthy changes and stick with them. In addition, we don't know yet all the interactions that these drugs have with other medications, herbs, or supplements. And so those are something to bring up with your doctor is that if you're on some kind of herb or supplement that is really important to you, there might be an interaction that we don't know of yet with these GLP-1 weight loss medications. Also, if you do have conditions like diabetes or high blood pressure, as you lose weight on these drugs, your medication dosages might be able to be decreased. So you might need less diabetes medicine, like for instance, your dosage of insulin could go down, and your blood pressure might improve so that you might not need as much blood pressure medicine. And so it's important to talk with your doctor about how your other medications might change because for something like diabetes and high blood pressure, if you're on too much medication for those conditions, you could cause low blood pressure or low blood sugar, which can also be quite dangerous for you. So it's really important to discuss with your doctor what other medication changes might be expected because of that weight loss from these drugs. And then lastly, are you willing to have the close medical follow-up necessary, either to review your other medications like we talked about, or to follow up on the potential side effects? It's really important that you be willing to do that close medical follow-up and to have that relationship with your doctor in case things change for you. Um, and so before, if you're thinking about what you can do for weight loss, especially since it's January, and a lot of us are thinking about New Year's resolutions at this time. If weight loss is important to you, certainly talk to your doctor. You can certainly ask about these weight loss medications. Everyone's situation is different and individual. But if you want to go about, developing those healthy lifestyle changes, like I mentioned, getting your sleep, stress, nutrition, exercise, all improved, we do have resources for you. And I want to highlight here the lifestyle management program at our health and wellness clinics. So this is a great program where you get one-on-one coaching. The coaches are fantastic. We have bilingual coaches as well. So if you speak Spanish only, you still welcome to have this additional coaching. There's no extra cost for this service, and they cover every part of lifestyle. They actually, in addition to what you're eating and exercising, they do actually focus a lot on sleep and stress as well. And who wouldn't want, a free coach to kind of oversee your lifestyle changes? So you don't have to make these lifestyle changes alone. This lifestyle program is available to you. Also, if your primary care provider is at the health and wellness clinics, your coach in the lifestyle management program can talk to that provider and actually suggest to them times where it might be important to recheck your labs or things like your blood pressure for potential medication changes. So I really highly recommend you either call the clinics directly or talk to our member services to get plugged into that lifestyle management program. In addition, we do have nutrition counseling one-on-one through Teladoc as well. Those sessions are really great if you have questions about your nutrition or if you have certain health concerns, such as trying to achieve a low sodium diet, low cholesterol diet, or anything like that that you would like help on improving. Please feel free to reach out to Teladoc as well. And with that, we'll actually go ahead and transition to Q&A. I know I threw a lot at you. Again, this is a rapidly evolving area, but I'd be happy to address any questions that might come to mind. Thank you.
please go ahead and submit your questions via the Q&A box, or you can go ahead and unmute yourself. Okay, Rosemary, we have our first question.
Oh, great. Okay, I see it. How do these new level of drugs compare to older options such as phentermine that were intended for short-term use? Is the gain back similar to those class of drugs, or maybe sounds more rapid on the new ones? It's pretty hard to compare. And even though for these new drugs, the data shows that it's about 2/3 weight gain within a year. Anecdotally, and you can tell from celebrities, and if you ever talk to anyone who's been on these drugs, oftentimes it's actually the full amount of weight gain comes back within possibly even weeks or months. And so the weight regain is very fast for these medications. And so it's hard for me to compare to kind of the older options such as phentermine, but the weight regain is real. And that's why it's so important to actually make those healthy lifestyle changes at the same time. Great question. Second question, how do these drugs affect someone who is gluten intolerant? Right now, I have not seen any contraindications or warnings for someone who is gluten intolerant. I think there is it's important to work with a nutritionist here on this one to just make sure that with the decrease in appetite, if you're to make sure you're still getting enough nutrients, especially if you're gluten intolerant and already have some limitations on what you can eat. Great question. And then we have another one. My doctor has written prescriptions for me both for Wegovy and Manjaro in the past year, and each time I'm told my insurance denies the request. How do I go about getting approved for this drug when my doc recommends it? So this one is a bit tricky for us. At this point, to my knowledge at United Ag, we do not recommend, we don't provide coverage for these if it's for weight loss alone. That's just our stance right now. We have plenty of resources for weight loss outside of these drugs. So if you have any follow-up questions on that, it's best to call member services to explain your situation and see if there's anything that they can do for to help. But in the meantime, I think the standard kind of healthy lifestyle changes still can go a long way while you're kind of working through that process with member services. And so it still makes sense to contact our health and wellness centers for the lifestyle program. But I know that can be quite frustrating. Great question. And then we also have another question. You say using these drugs is ongoing. Are there any long-term side effects? Yeah, that's a great question. Yes, right now the idea is that these are long-term drugs. They're not meant to be used for like 6 months or a year until you get to your goal weight and then get off of them. They're meant to be started on and for you to stay on them for the rest of your life. That may change over time, and so we'll have to see kind of what the data over time shows. But the long-term side effects right now are really the ones that we're aware of is what's on the warning. So, potentially issues with gallbladder, pancreas, dehydration, kidney issues, those kind of stuff. Those are the ones that they currently list right now for the warnings. But again, over time, we'll probably have a better understanding of that. Great point. Any other questions?
You do have someone with a raised hand, Rita, but
Oh yeah, Rita, go ahead. Can you?
I just unmuted her.
Oh, great. Thank you.
You might have submitted the question already, so I'm not sure if she's gonna.
Sorry, yes, you answered my question. I typed it. Thank you.
Yep. No problem, Rita. I know it's a frustrating situation, but again, member services is the best one to talk to about that one.
Okay, thank you.
Yeah. Any other questions? In the meantime, I'll ask Maribel or Jessica to see if there are any announcements you guys would like to provide.
We don't have any official announcements other than we do have another Health Chats episode scheduled in April. So we'll be going over the importance of sleep. So if you are available, we do have the event registration and at unitedag.org/events. So you can go ahead and register there.
Great. Thanks, Jessica. And with that, it looks like there are no other questions. I'd like to thank you all for joining us this morning and hope to have you join our next Health Chats in April. Thanks so much.
Thank you.
Bye, everyone.
Bye.